So welcome to the can't believe it's August Civic Coffee. This is a monthly event produced by Age Friendly Seattle and the Seattle Public Library. And we rotate these events around the city. So we have had the good fortune to be here at the Lake City Center, at the Lamb of God Church for the last 2 months. So thank you for hosting us and having us back, Lake City. And I'm joined today by Teresa Tam, who I'll introduce further in just a moment. But first, just a few quick logistical things. We are interpreting today's program live, and so we're going to try to remember to speak slowly and pause, but if anyone has questions or needs something repeated along the way, please ask. We're happy to do so. We're also here physically in person together, but we also have people joining us online. So for those of you watching online, we welcome your thoughts and feedback and comments as well. Feel free to put those in the chat and they will get relayed to us, and we'll do our best to answer those so you can participate as well. And what else? I'm gonna ask the Seattle Public Library, Emily, was there any announcements that SPL would like to make? Okay, just keep reading. So with that, we can get into today's program. So we're talking today about social isolation and connectivity. And this is a topic that often comes up. It's something that we're learning more and more about as a country, and about how important it is to stay socially connected in our communities with our friends, families, neighbors, community members. And we're learning more about the harms when we're not connected and how that can really harm our physical and mental health. So much so that the United States Surgeon General recently put out an official advisory really warning Americans that this is a national epidemic that we need to pay attention to. So I'm really glad that Teresa is here with us today because she's been doing work in this space for quite some time. Teresa is the Social Connection Project Coordinator at the Greenwood Senior Center, so a fellow senior center just across the way. She began volunteering with the Finney Neighborhood Association in 2016, providing services and companionship to older adults across the community. And then she was excited to have the chance to join the Finney Neighborhood Association in her role that she currently holds now as Social Connection Project Coordinator, where she works to reduce social isolation and loneliness and to increase social connectivity for older adults through outreach and program development. She's working on some really exciting things, so I'm glad she's here to share those with us today. She has a bachelor's degree in communications and a master's in public policy with an emphasis on health. And now we are learning more and more about how social connection is really squarely within the realm of health. So Teresa's got over a decade experience in healthcare program evaluation, and she's really passionate about supporting the physical, mental, and well-being of older adults. So I'm gonna hand it over to Teresa to do a little presentation about some of the work she's been involved in. And then I'm gonna come back and we'll have a conversation, Teresa and I, but also I hope with some of you who have questions. So feel free to think of things that you're curious to learn more about, and we're happy to have those as part of the discussion. So with that, thank you, Teresa.
All right, thank you, Dinah. Thank you everyone for being here in person today and everyone who's attending online. Big thanks to Age Friendly Seattle, the Seattle Public Libraries, and the Lake City Senior Center for having us here. So, as Dinah mentioned, my name is Teresa Tam, and I work with the Greenwood Senior Center, which is under the umbrella of the Finney Neighborhood Association, or PNA, you'll hear it called. And I'm here to tell you about what we've been doing with our Social Connection Project. All right, so how did this come about? Our prior director at the Senior Center, who just retired in December, she participated in a social isolation impact summit in 2020, which is kind of the peak of the pandemic, and we were all feeling very isolated. And it was put on by the Motion Picture and Television Fund virtually. And she thought this would be a great thing to focus on at the Senior Center. And so with funding from King County, the Veterans, Seniors, and Human Services Levy, she decided to create this position, and I'm the first person in this position. I started in April 2021, so I've been doing this about 3.5 years now. And it's a nice kind of enhancement to what the PNA and the Greenwood Senior Center already do, which is really focus on what all senior centers do, is focus on community and bringing people together. But we're really trying to, focus on it, help reduce stigma around it, help to talk about what the underlying issues are with social isolation and loneliness. So you will probably hear these terms, social isolation and loneliness, used at the same time and kind of mixed together. But they are actually related and different things. So people will generally agree that social isolation is a more objective term. It really is the number of people you're interacting with on a day-to-day basis, whereas loneliness is a more subjective term. So it's really how you feel when you are around other people. You are lonely when your goal of social connection is different from your lived experience. So I will use the two terms together, but just keep in mind those are the two differences there. Okay, so why do we care? Why do we care that we're isolated and lonely? As Dinah already mentioned, this is a health issue in the United States and in the world. The U.S. Surgeon General has made it one of his priorities to target. And there are all sorts of negative health impacts of social isolation and loneliness. So one study showed that being socially isolated can have the same negative health impact as smoking 15 cigarettes a day, which is actually worse than lack of physical inactivity. So it is not a small thing. And it can lead to, can create higher risk for high blood pressure, cognitive decline, anxiety, depression. There are a lot of things that it negatively affects. So we know it's a problem. How much of a problem is it? There's a number of studies that are done on this. This shows an annual study that's done by the University of Michigan, and they look at a number of variables, one of them being social isolation amongst older adults. And you can see from this chart that in 2018, 27% of older adults aged 50 to 80 reported feeling isolated some of the time or often. And that jumped to more than 1 in 2 in 2020 during our lockdown. And then it has slowly come down over the next couple of years, but we're still standing at more than 1 in 3 adults, older adults in this country, are reporting feeling socially isolated. This is another study done by a different organization, the Cigna Group, in 2021. And this kind of breaks down the differences within the population. So you can see this does not affect all of us equally. People from underrepresented racial groups are more likely to be lonely. 75% of Hispanic older adults and 68% of Black African American adults reported being lonely, and that's compared to 58%, which was just the overall survey population. And then people with lower incomes are lonelier than those with higher incomes. So 63%, which is nearly 2/3 of adults earning less than $50,000 a year, are reported being lonely. And almost 3/4 of people receiving Medicaid benefits reported being lonely. Unless you think this is just an older adult issue, it is not. It is pervasive in our entire society, and actually young adults aged 18 to 24, are twice as likely to be lonely as older adults. You can see 79% reported feeling lonely in this survey, and 41% of older adults aged 66 and older reported feeling lonely. So I would love, to see, I'm sure there are other organizations focusing on the younger adults. We just happen to be focusing on the older adults because we're a senior center, but maybe someday the P&A can also focus on younger adults. All right, so what are our goals of our social connection project? Ultimately, we're trying to help older adults form relationships, foster belonging. Feeling like you belong is the number one thing that's important to not being lonely, and create opportunities for purpose and meaning. And hopefully by doing that, we are reducing social isolation and loneliness. So when we started this in 2021, there really was no framework for this. This was something our director made up, and so we just kind of fumbled around in the dark until we figured out that there really were two main parts of this project. The community outreach piece, like what I'm doing today, engaging, educating, and learning from the community, and then also developing new programs. So I'll talk about all of that bit here in a bit. Okay, so community outreach examples. So in 2021, when we were new, a lot of what I did was come talk to people in the community and do focus groups, conversations, trying to figure out what older adults' experiences were with social isolation and loneliness. I've also worked with a couple different University of Washington graduate program students on doing some surveys of the community, and some of our programming has come out of those surveys. Of course, raising awareness, distributing information in the community with brochures and flyers, doing presentations like today. You can see here in this photo, I'm tabling at the Finney Farmers Market in the summer. So a number of ways to get out there. And participating in national forums. There's several that are focused on social connection. Commit to Connect is one of them that I highly recommend. And then community mentoring. So over the years that we've been doing this now, I've had more organizations contact me and want information on what we're doing and how they can do the same programs with their organizations. And I've had people in Wisconsin contact me. I've had people, in Queen Anne here contact me. So it really is all over the country. All right, so now the fun part that you all will probably be the most interested in, which is what are our programs? What could you listening today participate in? So I mentioned the surveys that I did with University of Washington grad students. Speed friending, which you can see pictured here, is one of those things. Our older adults said we want more one-on-one opportunities to meet people. And some people suggested speed dating, but we decided speed friending was a little more open and inclusive. And we have done 3 speed friending events to date. I've helped the Wallingford Senior Center do a speed friending event, University Heights Center. I know the Ballard Senior Center is interested in doing it. So if you want one here at Lake City, just let someone here know, and then we can do that. The backup plan for solo aging, one of my personal passions is what do you do as you're aging if you do not have the traditional support of family? So this is a course that I offer periodically, and it is for people to come together and talk about what the challenges and resources are to aging by yourself and how you can put together a plan for yourself as you move forward. And then Connect to Effect and Connection RX are kind of related. Connection RX really came out of Connect to Effect. Connect to Effect is just a 1-hour workshop. It was created by the AARP Foundation, and in it you come together and you create what's called a friendventory. which is a list of people that you want to get to know better, and then you come up with a plan of how exactly you're going to do that. So it's a great 1-hour workshop. But what I was finding from this, because I've done it at the senior center, I've done it out in the community at senior housing, I just found that, for some people that's enough. For other people, you do this 1-hour workshop and then what? You probably don't think about it anymore. So we came up with Connection RX, which is a 6-week program, which is similar in that you're coming together for that first meeting to kind of brainstorm, what are my challenges to being socially connected? What do I want to be doing? What are some ideas? And then over the course of 6 weeks, you have peer support to kind of encourage you along, kind of like an exercise group, a walking group. Instead, it's a social fitness group. And tech support group, you might not think that technology belongs here, but as we all learned in 2020, technology, whether you like it or not, is very important for staying connected in our modern day. Who here knows younger people who refuse to talk on the phone and only want to text you? Raise your hand. Yeah. Yeah, so we do offer that if you are interested in becoming a bit more tech savvy. All right, so more programs. So, on the loneliness piece, we're discovering, okay, some people know that they want to be more connected, but they're not entirely sure how. And sometimes you can lead a horse to water, but then that horse doesn't know how to drink. And so we've started offering some discussions on the topic of social skills. And what it's been is just 2 different books that we've read and discussed together as a group. We're doing one this fall based on David Brooks' book, How to Know a Person, which has come highly recommended. It's really a great book on kind of targeting the root issue of what's preventing us from connecting with other people. Because as a society, we're doing a very horrible job of connecting with other people right now. We also offer, if you are interested in forming a caregiving group for yourself, you need that social support because again, you might not have family members to help. We help organize kickoff meetings to help you think about how you might create that caregiving group. And then forest therapy. Who is familiar with forest bathing or forest therapy? Raise your hand. Very few people. Okay. Forest bathing comes out of a Japanese tradition called Shirin-yoku, and it is basically kind of a meditation in nature. It's not a hike. You're really just going out into the trees to connect with your 5 senses. And contrary to loneliness, it actually really helps improve health symptoms. So it can reduce anxiety, depression, and it can reduce loneliness because being connected with nature is often as powerful as being connected with other people. And you can see from the photo here, you also get to connect with other people during these sessions. We usually have a little tea circle at the end to talk about our experience with everyone that participated. We're doing one more of these this summer. We usually just do them in the summer in August. And the Unlonely Film Festival is not our film festival, it's a national film festival, and they call to artists who come up with short films about the topic of loneliness. So each year, I've done it for a couple years now, I select maybe 3 films and we watch them together at the Senior Center and then we discuss them. And last but not least, consultation. So we found that listening to a presentation like this or getting a brochure can sometimes be way too much information for people and they just don't know where to start. So I've come up with these consultations. If you are interested in learning more, you want to talk about what your situation is and brainstorm ideas for you specifically, that you can contact me and we can have a 30-minute conversation to brainstorm for you specifically. All right, so what have we learned in our 3.5 years doing this? For anyone that's here that's maybe interested in starting their own social connection project or online and are coming at it from that angle, tracking the impact has been very difficult because as you can see, this is not one program, it is multiple programs. So with Connection RX, it's a 6-week program. I am able to have a pre and post assessment and have kind of a good way to evaluate, but some of the others have been difficult. I do put out an evaluation when I can remember to do so, and I have some data on that here at the end that I'll share with you. Again, concierge, as I mentioned, with the consultations is key. Having one person in your organization that people can come to so they don't feel overwhelmed and they can have a safe space to talk to someone first about the situation before being thrown into a group activity. And this is a timely project, as Dinah mentioned, and I mentioned, this is a national, international issue. So it is not older adults only, it is not Seattle only, it is a lot of people. So there's no time like the present to be focusing on this. And then, we've learned that loneliness is a lot harder to address than social isolation. As I mentioned, social isolation is objective. So if you come to my speed friending event, you are objectively less socially isolated than you were before you came, but do you feel less lonely once you leave? And that's really the question. So we've been really trying to find ways to focus on that. One thing that we've learned in the research is that practicing compassion or loving kindness is actually an excellent way to tackle loneliness. So that's just one example of what we're doing there. Okay, so as I mentioned, I have fielded 108 evaluations, and of those 108 responses, 87% agreed or strongly agreed that they felt more socially connected or had more resources to increase their level of social connection because they attended the program. And 94% agreed or strongly agreed that they would recommend the program to others. All right, so that is it for my presentation. I'll hand it back over to Dinah, and I'd love to hear your questions. I'd love to hear your ideas. If you are interested in any of these programs in your organization, please contact me. My contact information's here, but I also have brought business cards, some brochures for the Senior Center. There's some bookmarks there too if you want a free bookmark that has my contact information on it. So thank you very much.
Thank you, Teresa. I have some questions for Teresa, but if others do as well, please do jump in. First, I do want to flag a couple opportunities here at the Lake City Senior Center. How many of you have been to at least one activity at the Lake City Senior Center?
We don't call it a senior center.
The community center, right?
No, it's the Lutheran Church.
Today, yes. Okay, great. So
Always here.
a lot of you have been to at least one event. How many of you have been to a bingo event? A few. Okay, so you know bingo exists. What about mahjong? Has anyone attended a mahjong event? A few? Okay, great. Excellent. You're making great use of the resources. What about the knitting and crocheting event? We got one. Excellent. So those are just a couple of the activities that I want to make sure that you know exist right here in your own neighborhood. And then I believe, Teresa can correct me if I'm wrong, that you are also welcome to join any of the opportunities that Teresa is talking about today as well. So first of all, where does the forest bathing take place?
So we've done it for 2 summers now. This summer, everything's happening at Woodland Park. Last summer, we did Discovery Park, Carkeek Park, Woodland Park, a park in Ravenna. But we found getting everyone in the same place was challenging. We have recently acquired a van for the Greenwood Senior Center. So next summer, I think we're going to have people meet at the Senior Center, and we'll all drive you there so we all end up in the same place at the same time.
So one thing that you said really struck me, which is this concept of social fitness, which really resonates because I'm thinking about the best of, I'll speak for myself. The best of my intentions might be to exercise every day, but there's always something that gets in the way of that, right? Whether it's, I can't find my gym shoes, or I'm feeling a little tired today, I'd rather just stay home. And I think we can fall in the same trap with our social activities too. So can you talk to us about some of the barriers that people face when it comes to being socially active, and what can we do to just actively overcome those? When it comes to exercise, there's some strategies that people suggest, like keep your workout clothes at the ready so they're easy to grab and you don't have that excuse anymore. But what about when it comes to our social fitness?
Yeah, that's a great question. I think the two main barriers are health challenges and transportation. That's been shown in a number of studies. And how do you deal with that? I think with health challenges, you just kind of have to have compassion for yourself and do what you can do. And also realize if you have mobility issues and don't want to leave your house, there are ways to participate online. We still do a number of our events online if you're unable to come in person. I think really there's also organizations like our PNA Village, which I didn't talk about a lot, but they offer friendly phone calls so people can call you as well. There are ways to work around not being able to participate in person. Transportation is a challenging one, and I think we are very lucky in Seattle that we actually have many more transportation options than folks in rural areas. So we always want to make sure that people are able to attend our programs. So if you are wanting to attend a program and don't have a way or can't afford to get there, we do offer free bus passes.
I'm just out of curiosity for folks in the room, has transportation been a barrier when it comes to engaging in the kind of social activities you would like to engage in? Yeah, I see at least a few hands. Yeah, it's not easy, right? So I would encourage folks to continue to access the types of transportation options that you've been accessing, and know that I think there's a little bit of a shift happening when it comes to some of the transportation options, some of the volunteer transportation programs that are really starting to recognize that transportation is essential for health, right? You need to get to those doctor's appointments, you need to get to the pharmacy, but what else is health? It's social engagement. So I think there's some shift happening for allowable rides to include social activities. So don't assume that just because it's for a social activity that it might be ineligible for a trip. So back to some of the programs that you operate, can you tell us kind of what the average age is, who can participate, where people come from?
We don't have an age minimum or limit. Anyone really can participate. And I'd say our average age is probably early 70s, and we probably range from 50 to 100 in terms of who's showing up and who we serve. I mean, we serve a lot of Northwest Seattle, much like Lake City does. But since the pandemic, now that we offer things online, we have people participating in our support groups from across the country. So really, anyone can participate, and you don't have to have a membership either, like some other senior centers. You just pay per session, and a lot of things are free.
And maybe that's a good follow-up question. So how much do various things cost, or which programs are free to access?
Yeah, I'm trying to think. Everything that I mentioned for the Social Connection Project, I believe, is free of charge. Oh, except for forest therapy. Yeah, most everything is free of charge that we're doing with the Social Connection Project. For forest therapy, we're partnering with Cascadia Forest Therapy, which has trained guides that lead our walks, and we have to pay them. So there is, we have been charging $10 for that.
But otherwise, totally free, and you don't have to have a membership. You could just show up and participate.
Yes, I want to caveat that for the Greenwood Senior Center as a whole, there are, our fitness classes cost somewhere between $5 and $10. Usually, if you come to a wine tasting, sometimes that's $15. But nominal fees, we have a lunch as well that's usually a $5 donation. So there are some things do cost, but not a lot.
And most of the things we talked about today, those are free. Yeah. Curious to know, so today we have multiple different languages being spoken in this room. So can you talk a little bit about cultural practices around social connections, and what are some of the range of experiences that people have when they bring their cultural backgrounds to these programs?
Yeah, I think that there are definitely differences in cultures. There are some cultures that are more what's called collectivistic, so they think more in terms of the community versus the individual. I know a lot of Asian cultures are that way. And so, there might be a little more support there than in cultures that are focused more on the individual person. But then there's also, I've heard in talking to other groups around the Puget Sound area that there can also be in certain cultures more stigma and shame around social isolation and loneliness. I spoke to an organization on the east side that said they have a number of members who came to this country to live with their children who are working here in the tech field, and they don't want to admit that they're lonely because they feel that will bring shame on their family and not look good. So there are definitely things to consider based on culture. And obviously, if you're in this country or if you go to another country and you are the minority in a majority culture, there can be culture shock, there can be not understanding cultural norms, so those can be barriers to connecting.
So I think what I'm hearing is it's so personal and so individual to all of us and how we approach this topic. You mentioned that you're available for consultations, again, because there's a lot of options out there and it can be hard to figure out which ones might be best suited for you. I'm wondering if we could do, I'm curious what those consultations look like, and maybe you and I can sort of model a mini one right now.
Yeah, so I get people calling for themselves. I get people calling for parents, for neighbors, for friends. And so it really is kind of a gamut. So yeah, I'm happy to role play one with you. Hi, Dinah. How are you? What can I help you with today?
I guess I would like to participate more socially, but I don't really know what that could look like.
Yeah, well, thanks for calling me. I really appreciate that. And, just want to let you know it takes a lot of courage to reach out, so I appreciate you doing that. Just tell me a bit more about your experience and what do you think is holding you back from connecting with other people? What have you tried? What hasn't worked? What has worked?
Well, I guess after the pandemic, I never quite got back into my old habits of seeing friends, going out, doing things. I feel a little more nervous to do that. This is all, by the way, real. Maybe I've lost some of my social skills. It feels intimidating to walk into a room with a bunch of new people. So those are maybe some of the things holding me back.
Yeah, that all makes a lot of sense, and you are not alone in this. There has been a lot of, I think, inertia since the pandemic. People got comfortable being at home, and now leaving their house is more of an effort than it was. They learned how to DoorDash their dinner, and so they no longer have a need to go out to a restaurant. So Yeah, and I think there is still some concern. Some people are still concerned about COVID and just not feeling as comfortable in large groups. So, there's several programs that I can recommend here at the Greenwood Senior Center, but I'm also, I've lived in Seattle for 20 years now, and so, based on where you live, I can also kind of help you brainstorm, if you don't live close to the Senior Center, what are some other things that you might participate in. So for you, I would probably recommend, joining Connection RX. It sounds like you could use that support of peers to kind of get you motivated to get out again. And yeah, I would also suggest the social skills discussion series, because we'll really talk about kind of what's underneath the feeling that you're not connecting with others. And I think many older adults feel embarrassed to say that they need new social skills because I've made it this far. How do I not know how to do this? But clearly, as a society, we are very bad at really truly connecting with other people. So you're definitely not alone.
Thank you. And scene. So I sort of just want to call you in real life now. Have you be my own social connection concierge. That's a great service because it is hard to figure out where to start, what might be available. And it sounds like you can help people figure out not just programs at a local senior center, but what else in Seattle is available to plug into. So what a great offering for folks. We talked a little bit about tech and the role that digital equity plays when it comes to keeping us connected. Do you have any tips for folks on how we can all stay connected even in the digital space?
Yeah, I think that the internet has it served a great purpose of connecting people in ways that we haven't connected before, but in some ways people feel that they are more alone now than they were before technology. And so I think the key to technology is making it work for you, figuring out what you are trying to accomplish, and then figuring out the technology you need rather than vice versa. A lot of people that come to our tech support groups feel very overwhelmed. I need to learn artificial intelligence. I need to learn, all these things. And then we step back and say, well, how are you using it in your life? Do you really need that in your life? And if you don't, then you don't really need to bother. But yeah, especially when you're thinking about your level of social connection, you could maybe do a brainstorm session either yourself or through one of our programs and figure out, are there ways technology could be involved in this and make me more connected.
I'm curious to know from those of you in the room, has technology ever felt like a barrier to being or staying socially connected? Yeah, I see a couple hands. What are some of the biggest challenges about that?
It's too expensive.
I heard it's too expensive. Do you mean like the devices themselves or the internet plans?
I pay $132 for Wi-Fi, so it's everything.
Yeah.
Toner is expensive. Movies and media are expensive.
Yep.
And I'm still working full time, so.
Yeah.
But yeah, a lot of that's just living in Seattle because it's so expensive anyway. But yeah.
Yeah, I heard, so I'm going to repeat a little bit of what you said just for the benefit of online listeners too, that it can be really expensive. And that ranges from the actual devices themselves, but also internet plans, not cheap. And then entertainment options that rely on technology, going out to a movie, that's quite expensive. And when you couple that with many folks who may be retired or living on a fixed income in a city where the cost of entertainment and technology is continuing to rise, that's pretty stressful.
On their technology are kind of reasonable, I think.
Library time limits?
Yeah.
Is that what you said? Library time limits. So yeah, so even some of the resources that exist out there, Library, you hear that? They have constraints, right? Some of you might have enrolled in the Affordable Connectivity Program, and which was a federal discount program for internet, but that sadly went away. Seattle IT does have a range of discounts available on their website. So if you haven't checked out Affordable Seattle, I would do that. It's got, you can easily kind of find out what you're eligible for discounts. But yeah, the expense is a big factor. What else?
How about stigmatism, cataracts, how much it costs? I mean, look, I think this is wonderful, but I can't, hi Teresa, I wouldn't recognize you for a million, I can recognize people if they're close enough.
So vision can,
It's
and
called a disability, but unless you're blind, it's not like you get money from the government for it.
yeah, so vision, and then I may add to that, hearing loss can be a big barrier to staying socially connected, because when you can't hear very well, it's hard to be in a noisy place, right? It's hard to, maybe you don't want to go to dinner with a group of people because you're constantly having to say, what? And that can be really frustrating. So vision and hearing loss can be big factors and barriers. And thank you, Teresa. So, okay. And did you have something to add over here too? Oh, we can come back. So yeah, so those are some big barriers to staying digitally connected in our day and age. Teresa, are you finding that with some of the folks you work with? Are these common threads?
Yeah, definitely. Everything in Seattle is expensive and continues to get more expensive. Interestingly, most of the people that come to our tech support group now come with their smartphones instead of computers. We're not dealing with that as much. So, and smartphones are expensive. So yeah, it is definitely a challenge.
What are other non-tech barriers that people have faced when getting and staying connected? The Seattle freeze. I moved here a couple years ago. Will you explain what your version of the Seattle freeze is?
Having a conversation with someone who seems really friendly, and then trying to follow up and make efforts that aren't reciprocated.
Yeah, thank you for that. That is my current understanding as well.
Really friendly, really nice. Hey, let's get together sometime. And you call, you text, you email. They fall into a black hole. Then you wonder, was it something I said? Did I have bad breath? That kind of thing.
Yes, exactly. So for those of you online, we're talking about this quote unquote Seattle freeze, which as is being explained and as I understand it, it's we have quite a friendly city, but sometimes it's hard to go the next level deep with someone and really make that friend and follow up. So recently my husband and I were introduced to a neighbor in our neighborhood, and we thought, they seem great. How should we go about being their friend? And just kind of that uncertainty, like, should we call them? Should we just go knock on the door? Are they gonna think we're weird if we do that? How far do you extend yourself? And then what if they don't reciprocate? Then we have to see them in the neighborhood and it's gonna be weird. So Teresa, you mentioned that you talk about some of these issues and kind of have a support group. So what advice would you give someone to kind of like bust through that Seattle freeze and be that initiative taker?
Yeah, it's hard, right? And I think what it boils down to is that you have to put in much more effort than you maybe really want to put in, unfortunately. I find myself doing this a lot. I'm the one that makes plans. I'm the one that reaches out to people. And there are a lot of people who just don't do that. And I feel like in Seattle, that seems to be more common. People are happy reading their book at home, or, I'm not sure exactly what's going on. I also think that when you live in a city like Seattle, you have competing priorities for everyone's time. I have a friend that lives in rural Vermont, and they don't have to plan anything in advance, and their neighbors are always available. Hey, you want to come over for dinner tonight? Okay, because there's not a Sounders game happening or an opera, or so there's a lot of things going on, and so I think it just takes effort, just like exercise does. You have to kind of commit yourself. I'm going to spend X number of hours a week focusing on doing this, and understand that there are going to be wins and losses, and try not to take the losses personally.
Yeah, I'll share one anecdote, which is when I first moved to this city, I wanted to meet some neighbors, and so I just wrote a bunch of note cards and I dropped them off at houses I didn't know who lived there, saying, hey, we're new, we'd like to get to know you, do you want to come over tomorrow for a glass of wine? And then we just waited, and it was very uncomfortable because we had no idea if anybody would show up. Everybody came. And it was, I think, a lesson to me that taking that first step, even though it feels weird and a little scary and awkward, it was reciprocated, and people wanted to connect. So if that gives anybody inspiration of just sticking your neck a little bit out there and seeing what happens, it was worthwhile.
Yeah, and another thing that I have found is that making things recurring, either participating in groups that are recurring or setting up plans that are recurring with friends, helps get over that, why am I always the one reaching out? I have a friend she's not a big planner, but she wants to hang out, and I came up with the idea, let's walk Green Lake once a week. And so now it's just on the calendar. I don't constantly have to be the one reaching out and asking her, hey, do you want to do something? It's a set event. And yeah, with a recurring group, it does take, Seattleites tend to be a little bit slower to warm up to, right? So if you're going to meet someone at a bar, chances are you may not hit it off the way you may hit it off with someone in the South, right? But if you're participating in a knitting group or a walking group, you have time to slowly get to know that person, and then at a certain point you can feel more comfortable trying to forge a stronger connection with them.
That's a great tip. So recurring connection. Do you have any other tips? Like what are one or two easy things someone can do? And we've talked a lot about social connection, about being with other people, but I kind of want to go back to this concept of feeling lonely, because even when you're with other people, sometimes you can still feel lonely. So what's one easy thing someone who's lonely can do to alleviate that feeling?
Yeah, I talked about compassion, which is a kind of you wouldn't think that would be related to loneliness, but the research has shown that when we are lonely, we are very internally focused. We're focused on ourselves. We also are guarded. We've been hurt by others before, and so we are going to be very guarded and not let other people in. And that is not a recipe for connecting with other people. What compassion does in practicing what's called loving kindness, which you can do for 5 minutes every day. And if you're interested, you can talk to me afterwards. I have a handout that I could send to you. Is that compassion switches that focus from focusing on yourself to focusing on someone else. So first of all, it forces you to stop thinking about yourself and think about other people. But then it also kind of breaks down those walls of you feel connected to that person because you are wishing them well. You are hoping that things are going well for them. So it really helps remove the guardrails that you have on yourself of not wanting to interact, and it helps you start thinking outwardly instead of just focusing on woe is me and the reasons why you cannot connect with other people.
That's a great tip. So it's helping us make that psychological shift. We have just a few more minutes, so I want to do a last call for any questions in the room or online before I ask Teresa to close us out with her final thoughts.
Is there a card with your phone number here? Yes, over there on the table next to the coffee.
So the question was, is there a card with Teresa's phone number on it? And the answer is yes. It's on the coffee table over here. And for those of you online, we can put it in the chat as well. Make sure you get that. Oh, just chats. Okay.
How do you get it out of the chat? Don't answer my question. I don't know what a chat is.
Oh,
There's people online.
But it doesn't matter.
Yeah.
It's totally irrelevant. I'm sorry. I just assume people can't hear me.
yeah, we invite folks online to put their questions in the online chat. So if they have them, we can answer them in the room.
Nobody asked a question.
So with that, I think I'll have Teresa just leave us with any of her final thoughts. Although before I do, I remembered one thing I wanted to share. We talked a little bit about how expensive it can be to engage in some social activities in Seattle. So if any of you do not already have a gold or a flash card, I want to make sure you grab one before you leave, and my colleague in the back can help get you those. So you are automatically eligible if you are age 60 years old or older, or if you have a disability, if you're age 18 and over with a disability.
Then you get a gold card or just a flash?
You get a flash card if you are age 18 and older with a disability, and you get a gold card if you're age 60 and older. What these cards do is they give you access to different discounts around the city. And so, for example, the aquarium is free. The zoo is 75% off. The Seattle Art Museum is only $5. Last week, the Pacific Northwest Ballet came on the directory offering 50% off their tickets. So this is a way that we're trying to bring down the cost of entertainment options in Seattle for older adults and people with disabilities, because you're right, it is not cheap out there. And so we're trying to reduce some of those barriers, and we're constantly growing the list of businesses that are participating. Just this summer, I think we've added about 25 new ones, which is exciting. Different restaurants, coffee shops, and some services that you might need, like auto repairs and things like that. So definitely check it out. Maybe Meg, if you can wave your hand and folks can talk to you afterwards if they need a card. Okay, so now I will officially hand it over to Teresa. Oh, do you have a question?
Yeah, what's the difference between a flash card and a gold card?
So there really is not much of a practical difference in terms of the discounts that it unlocks for you. It's just that the flash card is for people who are 18 and older with a disability, and the gold card is for people who are 60 and older in general.
You know, generally they say 18 to 59.
18 to 59 with a disability, and a gold card is 60 and above for everybody. Was that the same question that folks had?
Yeah, because people just don't understand it.
It's a little confusing, but
Not really.
our goal is to make it as easy as possible for as many people as possible to get the discounts. Okay, so Teresa, do you want to leave us with any closing thoughts?
I just want to thank everyone again for participating, and thank you for having me here today. And yeah, this is still a learning process for us, so we are always open to new ideas, new programming, new collaborations with other organizations. So feel free to contact me afterwards. My information's over on the table with the goodies.
Thank you so much, Teresa, for being here and for all of your work. And thanks to all of you for attending August Civic Coffee. Thanks again to Lake City for hosting us. Thanks to you online for joining, and we will see you in September.